Hello everyone, welcome to another video. So in today's video we'll be generally looking at headache and facial pain. Basically, what is headache? Headache is like a pain felt in any region of the head, while facial pain refers to the pain below the eyes and above the neck. So facial pain mainly involves the forehead, the cheeks, the nose, the jaw, and the mouth. So whenever any of these areas are paining you, it's referred to a facial pain. So both headache and facial pain can occur together simultaneously in certain conditions, or they can occur separately, and they can have like various causes, from simple tension or stress to like nerve conditions or infections. So in the recent videos we've been talking about the trigeminal nerve, when we did trigeminal neuralgia and when we did persistent idiopathic facial pain. So the trigeminal nerve is the fifth cranial nerve and is the main sensory nerve of the face and the front of the head. So the facial muscles, the sinuses, the teeth, the jaws, and the cranial blood vessels, they can all generate pain signals when they are irritated or when they are inflamed. So pain can also be transferred from deeper structures like the neck, the ears, or even the teeth, due to like the shared nerve pathways. Like I talked about this when we did ear otalgia, that is ear pain. So there could be primary otalgia, there could be secondary, whereby it's transferred from other places that share like a nerve with the ear. So let's look at the classification of headaches. So we have primary headaches, which are not caused by another illness, like tension type headaches, migraine, and cluster headaches, and we've actually treated all these topics. Then for secondary headaches are caused by another condition. So maybe you had head trauma, or hypertension can also cause secondary headaches. Then medication overuse can trigger headaches, and also sinusitis can cause secondary headaches. So I'm looking at the causes of facial pain. So we have the neuropathic causes, like nerve related causes, like we see in trigeminal neuralgia, then post-herpetic neuralgia, persistent idiopathic facial pain, glossopharyngeal neuralgia, then musculoskeletal causes, like for example the jaw joint dysfunction. This disorder can cause like facial pain. Then facial pain that can be caused by infection or inflammation, like sinusitis or dental abscess, or ear infections like otalgia. And transferred pain to like pain from the heart, in cases of angina, or pain from the ears, the eyes, the teeth. So all these other places that have like a connection with the face, they can cause facial pains. So some common conditions that involve headache and facial pain. So when we have cluster headaches usually comes with both facial pain and headache, whereby cluster headaches, they are more severe, they are one-sided, they are like around the eye, and they come with tearing and all of those things. Then trigeminal neuralgia just comes with facial pain. Sinusitis comes with both headache and facial pain at the same time. Dental abscess, there's only the presence of facial pain. So in sinusitis, there's usually like pressure in the cheeks, pressure in the forehead, and it's usually worse when the person is bending down. So there's usually both headache and facial pain like that occur simultaneously in this condition. Then for the jaw joint dysfunction, which is known as temporomandibular joint disorder, So here there's there's both facial pain and headache. And in this condition is most of the time is worse when you are chewing, because it involves the jaw and everything. So so that's basically it for like conditions that come together. Like headache and facial pain is like one of their particular symptoms. So when it comes to all this pain, like pain signals, they originate from nociceptors, that is pain sensing nerves in the skin, in the blood vessels, or in the deeper tissues. So these signals, they are transmitted through the cranial nerves to the brainstem, then proceeded in the thalamus and the cortex. So if the pain system becomes overactive or dysregulated, as seen in chronic pain or neuralgia, even non-harmful signals can be felt as like pain. So looking at when we are talking about headache and facial pain, so there are some conditions that when they come with both this headache and facial pain, we have to they come with like how do I put it, they come with other serious red flags, like other conditions that should be seen as like, okay, a serious case. So there's like meningitis, for example. It also comes with headache, it also comes with facial pain, but when it also comes with like conditions like having fever, having stiff neck, then even acute glaucoma and migraine that come with vision loss accompanied with the headache. So all these things, and also post hepatic neuralgia that causes facial pain after shingles, and also temporal arteritis that comes with weight loss, and comes with weight loss together with unilateral headaches in elderly people. So most of these conditions, they come with together with headache and the facial pain, and they are these other symptoms are like the particular red flags of this condition. So if a person has headache combined with these other symptoms, it's usually like the telltale signs that, okay, this person has this serious infection, and it's not just a regular headache that you can just give them analgesics or something. So looking at the treatment approach for headache and facial pain, is general treatment is just to give pain relief, and to identify and treat the specific underlying cause. In chronic cases, it's good to give psychological support, then also encourage lifestyle modifications, like encourage sleep, stress, better posture, hydration, because drinking water is very important. And so for the particular treatments for each type of headache, we're going to break it down. I know I've mentioned this before in the other topics, but this is just like a summary of all the topics that we've done concerning all these headaches and majorly everything. So treatments for tension headaches, we usually give tension headaches are like the normal everyday headaches that you can even get from stress. So we give normal NSAIDs and paracetamol. Then for migraines, we also give NSAIDs, and we give triptans like sumatriptan, and we also give antiemetics for the other symptoms like vomiting and nausea. Then cluster headaches, we give first line, we give high flow oxygen, sumatriptan injection. Then for trigeminal neuralgia, carbamazepine or oscarbazepine. And then for persistent idiopathic facial pain, we give amitriptyline and gabapentin. And for the jaw joint disorder dysfunction, we can give muscle relaxants or NSAIDs. And for sinusitis, decongestants. And then in cases of dental pain, analgesics are also useful. And otalgia, antibiotics, or like specific ear drops. So non-drug options: stress management, physiotherapy, using warm compress. So headaches and facial pains, they can have many causes, from stress and poor posture to nerve irritation or sinus infections. And if the pain keeps coming back or feels severe, it's important to get it checked. And treatments depend on the cause, and for some types of pain, regular painkillers may not work. Like in cluster headaches, for example, regular painkillers don't work in this case. And there are special medicines that target nerve pain, like gabapentin. And we may also look at the patient's lifestyle conditions. So that is basically it. So in summary, when we have tension headaches, so it's like a band-like pressure on the head. And for the treatment, NSAIDs and stress relief. For migraine, is like a throbbing headache, and we give triptans and NSAIDs. For cluster headaches, it comes with headache and facial pain, severe, and it's usually around the eye, and we can give oxygen and sumatriptan. For trigeminal neuralgia, facial pain like electric shock, and we give carbamazepine as the first line. Then for persistent idiopathic facial pain, it comes like a constant dull ache on the face, and we give amitriptyline. Then sinusitis comes with facial pain and headache. There's usually pressure around the head, congestion, give decongestants. And for otalgia, it comes with deep ear pain, which we particularly treat the infection with antibiotics. So that is basically the summary of both everything we'll be talking about concerning headaches and facial pain. So I hope I've been able to summarize everything to and to give you better understanding about all these topics. So I'll see you in the next video. Thank you for watching. Bye.